Welcome to the 340 Banter podcast. Maintaining your 340B program's oversight is one of the most important things a covered entity can do. Today, we're joined by Charnay Ingram, the pharmacy director at Samurai, a health center in Mississippi, as well as LaNika Ellis from FQHC 340B Compliance. We will be discussing tips and tricks that they've discovered along the way in maintaining their program's oversight.
So a big part of the 340B program within a covered entity is the oversight of that program. Who's involved in making sure that all the pieces of the program are, put together correctly, but also kind of regular review of the program to make sure that things are working the way they're supposed to be. Let's start with kind of the who. Who do you have involved in your 340B program to make sure that every aspect is covered?
When I think about the who, I think about who would be involved in the HRSA audit when it all comes down to it. Who are the different people in our organization that we have to pull in? Outside of the AO and the PC, or the authorizing official and primary contact, who is your 340B coordinator, your pharmacist, who is your medical director if you're doing clinic administered drugs, or even thinking about credentialing. I think they're left out sometime. IT is left out, and they're managing the TPA portals and your chart system. So just really thinking about where you get all the data that runs your program and the different people is a good place to start for 340B oversight.
And also just making sure your C-suite are aware of everything going on in the program, not just those who are running the 340B program. So not just your 340B coordinator, your pharmacist, but getting your C-suite involved in that as well. And that, like she said, include your chief medical officer, but your CEO and your CFO.
One of the things I've recommended recently is to use the HRSA data request list for HRSA audit as your guide of who needs to be involved. Credentialing is one of those things that is listed on that, so it's good to have them involved in the program oversight. And at my health center, we had kind of a core group that met regularly, and then we had auxiliary members that were pulled in as needed. We didn't pull them into every meeting because it was a lot of it over their heads, but we would pull them in regularly so they knew they were part of the team.
I think a really important part is being aware of all of the places that inadvertently touch 340B or that 340B, is interwoven within that may not be as obvious. So looking at the folks who build like the clinical order sets within the medical record, because how those orders come through, depending on how you're tracking clinic administered drugs, makes a much larger difference for hospitals than for health centers. But who's building those order sets in, how the orders for those drugs are going through, and how, specifically for hospitals, how that feeds over to the TPA is really important. You don't always think to involve them. For grantees, your grant managers definitely need to be involved because anything that changes in the grant could change what you need to have registered on OPACE. So being aware of those changes as they come about, working with the kind of the security or I can't think of the word, I'm so sorry, like the building maintenance folks, because sometimes offices move or you've acquired you've leased another part of a building that maybe has another suite number or something like that, that the rest of the organization isn't aware of because it's not a huge change that's going to impact everybody. But again, it impacts what's on OPACE. Think about your billing managers. If something changes or you started billing for another state's Medicaid plan, having that information is really important to the integrity of the 340B program, but also the things you do within the 340B program can impact those areas as well. So making sure that you're, involving the folks in every area that intersects with the 340B program in the decision making and in the, the regular report outs on oversight for here's how our program checks out right now.
Yeah, I think that's a great idea. Along with the who, I guess tell us a little bit about what you guys would really recommend as um, we talked about OPACE, that management. What does that look like? How does that really feed into your program oversight as a whole?
Well, for my health center, we honestly pretty much only have two main people that's running our program, and that's myself as well as my 340B coordinator. So I'm the PC. So I pretty much manage the OPACE, and she kind of backs me up to make sure that when she sends me, say for instance, a new contract pharmacy for me to add on there, she double checks to make sure I included everything on that I was supposed to. Um, and then once we both have eyes on it to make sure everything is straight, we make sure we let our AO know, okay, everything looks good. Just kind of double check behind us before you approve it and go from there. But I do think it's very important because, like Chelsea mentioned earlier, um, getting the grant person involved to make sure what is it? I think the 5B or 5A, one of those matches OPACE. And that's one thing that I had
Oh
to
yeah,
learn
your
because,
EHB,
yeah, EHB, yeah.
EHB Form
I'm
5B.
I'm not
Yeah,
familiar with EHB
yeah.
to say that I'm a PC. So, I think it's very important to make sure all of those parties connect together so that y'all can work off each other. And I don't think my grant person is aware of OPACE. So in order for it to be connected, both parties have to be involved.
Yeah, I've heard of cases where a site was terminated on EHB Form 5B, but they didn't tell the 340B team. So, something we've done recently and recommended for a lot of health centers is getting your 340B person, whether it's a pharmacist, a technician, whoever's managing your program, getting them read only access to the EHB. It's really um, it's not the easiest site to navigate, but we can easily figure out how to get to what we need.
No,
It's a really small piece.
I didn't know that was a possibility until I learned from you that you could have read only access to the EHB, and I think that makes such a huge difference for folks within an organization who need the information, but you don't necessarily want them to accidentally make changes.
And I think that's why it's always a fight to get the 340B personnel EHB access, because they're thinking you can get in there and change something or make a mistake, but read only access, you can't. So you give them the access without them having the ability to change things. I think Charnay brought up a good point as well. When we're talking about OPACE, usually the AO and PC isn't the person that's touching the program every day. It's the 340B coordinator. So just keeping that in mind as the PC to coordinate with that person. I think there's sometimes a gap in communication if you're not having that person to look back over what the PC did, because they can't go in there and see any of the changes.
And I would say it's a good idea, whoever doesn't have access to OPACE, to regularly export and check it over, because then you get another set of eyes checking it.
Right. And I always make the recommendation that after you go into OPACE and make any updates, once they go into effect, pull it again and check it, because what if the AO that can ultimately make changes without anybody seeing it, not having a second set of eyes, change something after the PC looked at it? So it's not a go in there, put it there, and it's right. You have to go back and check it regularly.
In other words, 340B runs itself.
340B
We
does
all
not
heard it.
run itself.
No, not at all. It's forever changing.
Let's talk a little bit about, I guess, real world or practical program oversight. I know that especially within health centers where everyone's wearing, at least 3 hats, often more, often many more. But within hospitals as well, other things, that are emergencies or priorities will pull, staffing resources from 340B program oversight, thinking about, your monthly internal claims auditing or TPA setting reviews, or it might even be your OPACE reviews. What are strategies that you guys have used within your health centers to make sure that 340B program oversight continues to be a priority, because for many people, my own health center included, you run into, okay, this month, this is going on. It's a huge issue. We'll skip the 340B audits for this month and we'll do them next month. We'll do 2 months worth next month. But that continues on. And all of a sudden,
another fire lights.
another
Right.
6 months later, you're like, oh my gosh, nobody's
haven't
audited anything in 6 months. So how do you make sure that it continues to be a priority for the organization?
I think that realizing that 340B is not a one-person program, it takes a team of people. A lot of times it's one person there's only one person that knows how to go into the TPAs, run the reports. So spreading the knowledge of what reports are you pulling, teaching someone else how to do the external audits and what to look at. So if that one person is gone for extended amount of time, there is someone else that knows the program and what to do. And not just that, it's heavy for one person. Even with smaller organizations, often it's the one complaint I get that they don't have the buy-in of a team. And realizing that it's not just a pharmacist that can do a lot of this oversight. It could be a technician. It could be some
Pharmacists are generally not the best person
Right.
to do.
You would have
this
medical
on.
assistants,
right?
Yeah.
Anybody that's familiar with the charting system, you can teach them to audit the claims. So just utilizing all the other parties that may not be in the pharmacy to help, nurse managers or however.
Unfortunately, for my health center, we do have that downfall of only having us two. So my 340B coordinator does the bulk of our things. So I try to be her backup, but like LaNika said, I have my own tasks, so it's kind of hard to try to keep familiarized with the things she has to do. So we usually try to make a plan to make sure, okay, she has her calendar set. Okay, she's going to do most of her audits like at the beginning of the month. Then she might do her clinic audits towards the end of the month. So, of course, if she has planned vacation time or anything like that, she tries to make sure she plans her audits around those times. But the disadvantage of that is because she's the only one doing it, if anything suddenly happened, then it falls on me to make sure that at least it gets done or partially gets done. But a good thing is having that backup, even if it's not someone in your team, a third party team, a consultant team, to be able to help you have that third party person to back you up if your main person can't do it.
One of the things at my health center, because I was really working in our entity-owned pharmacy, was using the technology you have there. And I would schedule reports. So I didn't have to think to run them. They'd already come in, and that was my reminder that I need to do my duplicate discount audit. And it took me 2 minutes to do. It's not a hard task if you get in the gist of things, but having that report automatically drop at a certain time was the indicator to me or another pharmacist. And we'd send an instant message saying who's doing duplicate discount. So we made sure somebody on the team did it, but I wanted all the pharmacists to be involved in that part. So they had skin in the game.
I think another thing is having a monthly task list of the things that person looks at, so that so if they do go away or something happens and they're looking at something other than just the normal claims testing. So like you said, duplicate discount, a lot of times they'll remember to check it for the pharmacies, but what about the clinics, So making sure that there's a checklist of the different things that they look at in case they can't, you will at least have a starting point. And so many
It's the win the lottery, hit by a truck
situation.
Situation. You want to make sure that no matter what happens, there's not one person holding all of the knowledge for what needs to happen to move forward.
Darren's on our team is constantly trying to get me hit by a bus. So
Trust me, he has all the checklists ready to go. So
another thing I think is really helpful in that regard is, Charnay, you talked about how important it is to have the C-suite involved in your program oversight, and having, your C-suite have an understanding of the 340B program, its importance, but also the risk points within it. is really helpful because as, crises, fires come up, whatever, that, the pharmacy department is being asked to manage, to mitigate whatever the case may be, being able to talk to, your chief compliance officer or your chief medical officer to say, this, we're here, we're ready to help based on the resources we have. This is what we can realistically get done in this time. Can you help us, maybe triage things that don't need to sit, pieces of these solutions that don't need to sit with us for this month. And we can pull in, resources from, as you said, it could be, a technician, an MA. Heck, we've had administrative assistants help with auditing claims plenty of times too, just like cross-training ahead of time, but then being able to meet with your C-suite to say, we're here, we're ready to help with whatever we need, but realistically, this is what we have the resources for right now.
But I also think it's not just your C-suite, your entire organization should be familiar. One thing that we do is doing new orientation. My 340B coordinator goes in, gives everybody an introduction of the 340B program. One thing we wanted to start, but we didn't kind of get a chance to get it off the ground yet, but we're still working on it, is what we call like a fun fact, something that can get sent out, whether it's quarterly, did you know? That's what we like to call it, did you know? So it might be a quick fun fact about 340B, because a lot of people think, when they think 340B, they just think pharmacy. 340B is not just for the pharmacy, because if you have clinic administered drugs, that's your clinics as well. So it's not just the pharmacy. Yes, it might be meds, but it's the organization as a whole.
And the impact of the 340B program
keeps programs running.
Extends
programs.
far outside the pharmacy.
Mm-hmm.
I think also going back to your point about the C-suite is, as the pharmacist, holding people accountable. So say it's the providers not putting in orders. They're not going to look at the pharmacist as the person that can hold them accountable for the things that they should be doing compliance-wise. So a lot of time it's good to involve your C-suite or your medical director in okay, I see that this drug was given to a patient. It's not on the drug logs. Who is going to be the person to hold the people outside of the pharmacy accountable? And I think the C-suite is a good place for that.
I think
as well.
key to that, I'm a big proponent of C-suite getting education in 340B. Do 340B University on demand at minimum. It's free. You can do it from home, but even better would be attending 340B conferences. So they're going there with the 340B team or pharmacy team, and they're seeing the in-depth of it, because then they feel more invested in it.
And I also think a lot of times, unfortunately, nobody understands all the areas that 340B touch until an audit. And then it's kind of
and it's definitely when you want to find out.
At my last entity, it was kind of the case where as a 340B coordinator, I was looking for information, hoping that I was looking at the right stuff. And we know a decade ago, there was not a lot of detailed information about FQHC. So just trying to figure out the oversight that we should be providing, and then having a HRSA audit and seeing all of the different pieces come together. The C-suite was like, oh, the 340B program, we all need to, get on one page and do this correctly, have our committee meetings and make sure everybody have a baseline understanding about the program.
And that's one thing we try to consistently do, is have our quarterly 340B meetings. Even if everybody doesn't participate, you're getting that knowledge. You're seeing how your 340B program is growing and how it's benefiting others. So it's good to
That's a
exchange that
great point, because
information.
I think a big part of 340B program oversight is managing or balancing program compliance with, program optimization. You want to make sure that you're running a compliant program, but also that you're leveraging the 340B program to its fullest for your organization, for your patients, for your community. You guys want to talk a little bit about kind of the different ways that you engage with your 340B oversight committees to make sure that both of those are priorities for the folks in the organization?
Initially, for us, there was nobody on like the committees that they had already. So say your QI committee. So getting added to those type committees, and I started to present the numbers because the C-suite is numbers people. They want to know the number of prescriptions, the profit. So starting right there with grabbing their attention that this is the 340B program. This is how much we saved by utilizing 340B drugs. If this was to go away, the profit or even the cost of running the organization would go up extremely. And then also just making sure that we can maximize what we are, maximize the program while still staying compliant and making sure they understand, because say contract pharmacies, you have to walk the fine line of, is this compliant? Having all the guardrails there to make sure that you get the profit, but also are not in the area of risk.
I think along with that is finding dashboarding metrics, your KPIs, key performance indicators that matter to your leadership. There's some things they're not going to want the details on. So really keep it simple. Get the things that they're going to want to know. But it's important that you track that. And one of the things we just started tracking for a lot of clients that has seemed to be very beneficial in my space and advocacy is the amount of charity care provided in the pharmacy for those cash pay patients. When you're passing on that discount, that is a great tool to have for advocacy. It's a really simple calculation you can do, and you're able to show if you go to talk to a legislator or talk to other policy makers, and there's accusations that we're not passing on the discount. We can say, yes, we are. This is what our patients are saving in medication cost every single month. And it's a really easy metric to pull, but what I've seen, the boards and C-suites really like to see that.
But piggybacking off of that, I think it's a great idea for everyone to understand where their 340B savings are being used.
Mhm.
Because just from experience, I know HRSA, they'll come in and they'll probably ask, okay, what are you utilizing your 340B savings for? But if everybody is not aware of that, then you're kind of just saying, okay, well, this is just a program. I know we have 340B savings, but I don't really know what they're doing with the money.
Or they'll say, we help ensure access to care, but they
Right.
don't necessarily
Know
know
what
where
the
or
access
how.
is.
Yeah.
And I think that's a good place that the pharmacy team or the 340B team can sit down with C-suite and say, let's sit down. I know everything goes into the general fund and we just take
Mm-hmm.
care of what needs taken care of, but let's assign these dollars to services. That
Yes.
way, when we're asked, we're all saying the same thing, and we're saying this funds are medication assisted treatment for the patients with opioid addiction. This funds our dental program and or other service lines that you're helping. And that way everyone's on the same page. And it's not that you have to say where every dollar goes, but have an idea what services might be in jeopardy if 340B went away.
Right.
I also think crafting a 340B narrative of your program, just
Yeah.
telling the story of your program, um, like you said, including we have these services. And then with that narrative, not just the pharmacy be aware of it, send it out to the whole company. So when they're talking to people, they can tell them our 340B program supports this and this service. I think that's important.
I know Apexis has a templated, program narrative or one pager, and so does CV 340B or Community Voices of 340B. So for organizations that don't already have one and they're kind of trying to figure out where to
I think
start.
340B Health does as well.
You're right, they
And
do.
NoddlePod, there are a ton of examples from other health centers for the health center folks.
Yeah, so really helpful if you don't have, or if an entity doesn't have one yet. You don't have to recreate the wheel. You don't have to start from scratch. You can start, with a template and work from there.
And that's just a good idea, period, of knowing your resources for 340B. That it's not just your 340B team that needs to know these resources. Bring it out to everybody.
Phone a friend.
Yeah. So that everybody in your organization or everybody that's is an intricate part of your 340B program knows where to go to look for these different frequent questions, you know?
One thing I like to show clients when I'm doing their audit that they didn't realize was available is the Pexis website on the resource pages and the Medicaid resources by your state. Um, giving your billing,
It's
giving your
bookmarked
billing,
in my
yeah,
browser.
telling your billing department this is where you can find all of the billing details for your specific state when it comes to 340B. Without it's sometimes hard to talk the same language that your billing team talks.
Mm-hmm.
So giving them the direct resources, and like you said, utilizing the resources, knowing where they are, and
Apexis has so many resources, and Apexis Answers is a great way to maintain oversight. Um, it's a safe place to ask questions. They don't give specific information back to HRSA, so you can call, chat, or email them, and they're really helpful.
and then in oversight as well, they have all of the self audit templates there. So when you don't know where to start, that's a good place to go. Pull the templates and then make it fit your program.
Mm-hmm.
Yeah.
Well, thank you so much for joining us today, ladies. Really appreciate it.
Thank
Thank
you.
you.